Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the Central Disease Control Headquarters on the COVID-19 outbreak. Earlier in the morning, South Korea reported 168 new COVID-19 cases, keeping the figure below 200 for 3 days in a row. The briefing has just begun, so let's take a listen.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for September 5th, Saturday. As of today, midnight, we have 158 new local infections and 10 new imported cases. The total caseload now stands at 21,010. 226 more people have been discharged following full recovery, while 4,668 people remain in quarantine. We have 159 patients with severe or critical conditions, up by 2 from the day before. And unfortunately, we had 2 additional fatalities. And we extend our deepest condolences to the deceased and the members of the bereaved families. Let us now take a look at the updates of the domestic infections by region. As for the statistics by noon today, and related to Sarangjeil Church in Seongbuk-gu District, Seoul City, we have 4 additional cases being confirmed from contact investigation, and total we have 1,156 cases being confirmed to date. Among them, 592 are worshippers and the visitors to the church, and 484 people are secondary transmissions, and we have a majority of them over the age of 60. And in relation to the August 15th Seoul rally, we have 37 additional cases being confirmed from investigation. In total, we have 510 cases being confirmed to date. Of them, we have seen 239 confirmed cases of further transmissions, and we also have a higher number of those who are in the non-metropolitan area. And we also have found that in Daegu Bukgu districts, in relation to a health supplement business seminar, we have a total of 30 cases being confirmed there, and we have confirmed that there are relations to the Seoul rally, and we are conducting further investigations to date. Next, in relation to Jinung Global in Dongjakgu District, Seoul City, we have 3 additional cases being confirmed. In total, we have 39 cases being confirmed to date. And related to Seoul Asa Medical Center in Songpa-gu District, Seoul City, we have 1 additional case. In total, 7 cases have been confirmed to date. And in relation to Kupang Songpa Second Camp in Songpa-gu District, we have 2 additional cases being confirmed. In total, 3 have been confirmed to date. Moving on to Gyeonggi-do Province, in relation to the Halim Dongtan Seongsim Hospital, we also had the first index case in earlier this month, and we have 1 additional case being confirmed, and in total we have 2 cases being confirmed to date. We are carrying out our investigation. And in relation to the Paradise Hotel in Incheon City, we also have the first index case of 31st of August. We have 7 additional cases, and total we have 8 confirmed cases to date. And in Chungcheongnam-do Province, in relation to a kimchi factory in Chungyang-gun County, we have additional cases and a total of 23 cases being confirmed to date. And in relation to a real estate auction official meeting in Yeonjae-gu District, Busan City, we have 19 cases being confirmed to date, with 6 additional cases today. We have 10 imported cases today, and as for the countries, we have seen that 3 were from the U.S. And looking at the people, the patients with severe or critical conditions, as of now, as for the fatalities, we have the death toll standing at 333, and 324 of them had underlying illnesses, accounting for a majority of them. And as for the age group, this is decreasing steadily. And as for the patients with severe or critical conditions, we had 2 more compared to yesterday. Those over the age of 60 account 85% of the total, and we also have those age over the age of 60, and also as for those with underlying illnesses who can develop into critical conditions once they are contracted with the virus, we ask you to stay home as much as possible, and if you have to step outdoors, please wear your face masks at all times, and if you have symptoms or other respiratory symptoms, and if you do not feel well, please visit the clinic center and get tested as soon as possible. And we are conducting our clinic testings, and right now we have also seen the expressing of the intentions by over 2,000 people who have been willing to donate their plasma samples, and over 1,900 people actually completed their blood donations, and we have up to 1,318 people in Daegu City and Gyeongbuk Province who have expressed their intentions to donate their blood, and a majority of them have actually completed their donations. And we will also like to extend our deepest appreciation to all of the people who have donated their blood, and especially to the Daegu Metropolitan City and the Red Cross in Daegu Gyeongbuk region, and as well as all of the worshippers in the Shincheonji the religion who have expressed their intentions to donate their plasma samples. And going forward, we will expand the clinics and institutions that will carry out the plasma donations. And we have up until right now, we have about 23 institutions nationwide, including those in Gangwon-do province, have been receiving these plasma samples. And starting from September, we also have 25 more Red Cross centers nationwide, including Jeollanam-do province and including Jeju-do Island as well, which will be receiving and accumulating the blood plasma samples. And we ask for your active support going forward. And we also have the safety e-report run by the Safety Ministry. And we also would like to introduce to you one case that has been reported. And it was reported that in Seoul City, there was a religious group that gathered group gatherings. However, went to the Daejeon city and went to its Daejeon religious church branch, and they went to a related coffee shop and held a group meeting. So we would like to note that all of the religious centers and churches need to switch their regular services to online means and refrain from having social gatherings and as well as other events. Yesterday, as it has been announced, in the metropolitan area, we have the intensified social distancing measures, the intensified level 2 social distancing measures, that is. It will be extended for another week until the 13th of September. So this means that when you are using restaurants at this region, starting from 9 p.m. to 5 a.m. the following day, you cannot dine in. Rather, you have to take use of takeout and delivery services. And on top of the franchise coffee shops, all of the franchise bakeries and ice cream shops as well, they need to also comply with the delivery and takeout only services. So dining in will be not permitted for these places. And as for the indoor sports facilities, whether they be golf clubs, swimming pools, as well as badminton and so forth, it is suspended from operation. And all of the study groups and study cafes will also be prohibited from opening. And also on top of these cram schools, we also have banned the gathering of vocational institutions as well. And nationwide, we have the level 2 social distancing measures being extended as well for the entire nation for another 2 weeks. And we also believe that that participation by the public is of utmost importance. So we ask all of the public to refrain from having and going on social gatherings and events or travel. And if you have to step outside, please wear your face masks at all times. Last but not least, now COVID-19, in relation to COVID-19, that is, each of the efforts and the sacrifice put forth by individuals need to also be put into effect, and we believe that these will also yield into great fruits. And we also believe that there is another risk of an infection a massive infection, which could lead to a nationwide outbreak, and this could also put a great burden on our quarantine efforts as well as our medical capacity as well. And it is a very important situation right now, so we need to comply stringently with the social distancing, and by doing so we can regain our routine daily lives. The quarantine authorities will begin our large nationwide influenza vaccines. However, we believe that during this season, as we move into fall and winter, we also have the seasonal conditions which will also benefit COVID-19 from spreading. And also we have seen many countries in Europe that have eased lockdowns and are also going into a second large wave and we shall learn from these examples. Looking at today's trends and outbreak, there are many hopes that we have right now. First of all, we have a large decline in the number of outbreaks, and also we have seen a decline in the ratio of untraceable patients, and we are also seeing a decline in the trend of the increase of those in critically ill conditions. And also we have many people getting tested as well, and we also have a relatively low fatality rate thanks to the medical practitioners exerting their full efforts. And we believe that these are the effects that have been proving that thanks to the support by the public in our quarantine and social distancing measures. And we have mentioned that we cannot be free of any further outbreaks going forward, and we need to maintain the situations under our quarantine capacity. We believe that we will have a resurgence going forward, and repetition of resurgences, number of resurgences that is in the future. And sometimes we could also elevate our social distancing to level 3 if needed. However, we believe that this should be the last resort. And if we cannot contain the virus, even with intensified social distancing measures, we believe that this will be an important experience for our Korean society. If we can curb the virus and flatten the curve going forward, we believe that this will be helping us to learn the importance of endurance and perseverance, and the importance of solidarity as well. And if we have positive results unfolding before us, we believe that these were all possible thanks to the participation put forth by the public. And as an quarantine official, we believe that the essential routines that are linked to the livelihoods of many people need to be prioritized. And as for the facilities that have had a great increase in the cluster infections, we need to continue to carry out social distancing in these certain facilities. For the quarantine to be maintained, we need to maintain our daily lives as well. There are many people like the self-employed whose daily lives are very important, and their livelihoods are dependent on their daily routines. And in order to recover the routine daily lives, please participate in the social distancing measures and wearing a face mask during the weekend, and please take part in these measures. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming newscast at 6 p.m. Korea time. Until then, goodbye.
The COVID-19 outbreak is emphasizing the importance of wearing a mask, as the virus is transmitted mainly through respiratory